Located in northeastern Kenya and bordering Somalia to the east, Garissa County is a home to nearly 900,000 people. The county is known for its nomadic pastoralist culture and trade with the coast and the interior regions of Kenya. Garissa County continues to face developmental challenges including infrastructure, education and healthcare.
Poverty iko wengi sana, wako chini, maskini iko chini sana because these are farmers, wengine ni farmers along River Tana, wengine livestock ya pastoralist, lakini zote animals zimekufa. Juzi floods zimekuja na ikafanya hawa chini sana upande ya uchumi sana.
Health challenges faced by marginalized communities arise from a complex interplay of social, economic, and environmental factors. These communities often encounter difficulties in accessing quality healthcare services due to reasons like geographical isolation, a shortage of medical professionals, and financial constraints.
Wacha nikwambie ndugu yangu, changamoto moja kuu haswa ni pesa. Kama mimi sasa sina kazi nilikuwa nafanya ilisha juu mwanangu aliugua akalazwa, pesa ikaisha kama matibabu. Changamoto kuu ni hiyo sasa. Pesa. Kama una pesa, then you are not able to get any financial ama any medical attention.
Shida ni madawa. Madaktari ni wachache. Unaweza enda upige foleni, ikifika masaa fulani waambiwe ule daktari mngojee atakuja, yule anahusika na shida yako.
Matibabu most of the time doctors are very few. So referral iko mingi, you might go to Nairobi for referral.
Overcoming these obstacles necessitates a holistic approach involving collaboration among healthcare providers, community organizations, policy makers, other stakeholders to address disparities, improve access to care, and promote health equity. Some of the services offered during this health camp include eye care services, dental health services, and health education, among others. Non-communicable diseases present a major challenge in Garissa County. Health assessments, including measurements of blood pressure and blood glucose levels, were provided to detect anomalies associated with conditions such as hypertension and diabetes, respectively. From the screened patients, 26% suffered from hypertension, 3% had diabetes, 7% had osteoarthritis, and 20% had respiratory tract infections. Patients diagnosed with chronic illnesses were directed to the NCD clinic, where they were enrolled into the Zuri Health's continuous care program aimed at efficiently managing their conditions. This initiative guarantees ongoing support for patients, including discounts on medications and tests, as well as complimentary consultations with either a doctor or a nutritionist. Cancer is one of the 4 major non-communicable diseases, which together with cardiovascular diseases, diabetes, and chronic respiratory diseases cause over 60% of global mortality rate every year. An estimated 10 million deaths attributed to cancer are recorded annually, with about 75% of these occurring in low and middle-income countries. In Kenya, the risk of developing cancer before the age of 75 years is 18% among women and 14.3% among men. However, millions of lives will be saved if strong cancer responses on universal health coverage are developed. During this camp, a total of 168 women underwent screening for both cervical and breast cancer. 10 women with suspected cases of cervical cancer were subsequently referred to the hospital for further evaluation. Child welfare plays a crucial role in healthcare, as neglecting it can lead to serious consequences. Child maltreatment is a pressing public health issue linked to heightened risks of adverse physical health, mental health and development outcomes, as well as increased rates of illness and death. In disadvantaged communities, existing health disparities further exacerbate these negative health outcomes. During this camp, Gertrude's Children's Hospital sought to bridge the gap in children's health and improve their health outcomes.
Gertrude's Hospital Foundation will be providing medical services to children from 0 to 21 years. And so we'll be providing pediatric services as well as those who need to be seen by the subspecialists. They'll be able to access them through our Dr. Smart telemedicine program. We have specialists who will be able to see the children who require further specialist care through the Dr. Smart telemedicine program. We have seen over 200 children who needed access to the pediatrician. And out of these 200 children, we have also been able to pick those who require further care, about 10 of them. Some of them need surgical care, and also there are those who have heart conditions that they were born with, so we'll be able to provide free heart surgery to these children. And also we've received some children with malnutrition. That means they have undernutrition, and we've been able to refer to the nutritionist to follow them up. And through the partnership with the M-Pesa Foundation and Zuri Health, we'll be able to follow up on the children who will be coming to visit the main hospital, Gertrude's Children's Hospital in Nairobi, so that they're able to receive specialist care and treatment, which includes correction of cleft lip. That means children who are born with a cleft in the lip. So we'll be able to provide free surgery for that, as well as those who require corrective heart surgery. So there are about 5 children, and we'll be able to provide that treatment for free.
In addition, eye and dental screenings were offered. A thorough eye screening was carried out for a total of 705 patients exhibiting various eye-related issues. Reading glasses were distributed as needed, and those requiring additional evaluation were referred accordingly.
Mimi pia nimehudumiwa, nimepewa hata macho 4 ndio hii. Saa hii hata naweza soma jina mzuri sana. Angalia sasa hii kama hivi imekuja kubwa. M-Pesa Foundation Medical Camp. Yes, I can now see. Sasa ninaona kama in fact nimefaidika, nimefaulu. Sasa upande wa change, hata kuangalia saa ile naangalia pesa, najua hii ni pesa fulani, hii ni pesa fulani.
Moreover, medications were dispensed for various eye ailments. In contrast to previous medical camps, no dental extractions were conducted in Garissa County. Of the patients screened, 8% exhibited dental caries, while 70% of these patients displayed chronic apical periodontitis. It was vital to integrate health education and advocacy in this medical camp. Patients received education on the significance of maintaining oral hygiene for their overall well-being. Furthermore, medications were provided to patients diagnosed with various dental conditions. The M-Pesa Foundation, along with its partners, is dedicated to decreasing the prevalence of illnesses in Kenya by offering complementary medication, screenings, and health insurance to underserved populations. As part of this initiative, 10 patients afflicted with chronic conditions like diabetes and hypertension received a 1-year NHIF cover to help them manage their conditions effectively. This camp recognizes advocacy for health education as an essential driver of individual and community well-being. Community health promoters actively interacted with community members during the registration process, enabling them to gain a better understanding of their health requirements and, in turn, empowering them to make informed decisions about their well-being. The pursuit of a healthier Kenya continues beyond this point. The collaborative efforts between M-Pesa Foundation, Zuri Health, and county governments contribute significantly to the goal of achieving universal health coverage.
Our participation in the Garissa medical camp is to enable us promote early diagnosis of children with various conditions. So once we diagnose them early, then they'll be able to access treatment early and improve their treatment outcomes so that they can readily go back to school and have an improved quality of life. We understand that pediatric care is not readily available throughout the country, and therefore we will be able to improve access for the population in this area.
We need your services every time. Kuja every time, so musaide, because Garissa, maybe it's level 5. Lakini we need so many doctors like this. They came and been some. Kuna mtoto saizi nimpeleka pale, alikuwa na heart problem, ametibiwa, we were given the forward management yake. Mahali tapeleka, like he was telling me, Lions in Kapgemi. So nawezaenda huko alafu nione daktari ambaye anawezana na hiyo kazi.
Hakuna usaidizi nimekosa, kwanza up to Z mpaka matibabu haya ninayo, madawa tele, na shukuru alhamdulillah. Tena nawakaribisheni tu sana siku nyingine, Mungu akipenda Maulana.